First, we'll begin with a thorough hand washing. Washing the hands for 15 seconds and making sure that we remove any rings that are on the fingers so that we can get to the surface below them. Then we dry the hands thoroughly. A hand sanitizer after you wash your hands, make sure that you get rid of all the bacteria that could be left from the hand washing. Before donning a suit, vitals must be taken. Placing legs in the suit, one after the other, ensuring to get the feet all the way into the toes of the suit. Next, we place our boots on the feet. Once we have both boots on, we begin taping the seam. We tape between the suit and the boot to ensure that we have a good tight seal. 3 layers of tape are placed on the seam. The second layer can be between the tape and the boot or the tape and the suit, ensuring that all 3 are pressed down firmly. Once this process is complete, we will now place the latex inner gloves on our suit donner. They will then stand up and place their arms through the suit. Next, we will go behind and tuck in the hood that belongs to the suit. This is not needed when using a powered air purifying respirator. Next, we zip the suit up halfway, ensuring to leave enough room later to tuck the inner shroud of the hood inside. The seam is then taped, Next, we get our outer gloves and place them on our suit donor, ensuring that the cuff of the gloves go over the suit sleeves. After making sure that the gloves are on securely, we tape the seam between the glove and the suit using the same process that we used with the boots earlier. While our suit donor rests, our suit support person must perform a flow test on the powered air purifying respirator, ensuring that once turned on, the gauge will read above 6 cubic feet per minute. Once the test is complete, the suit support person will place the powered air purifying respirator on the waist of the suit donor and secure it in its location. Pull the strap until the waistband is snug on the suit donor, but not too tight, so as to be able to place 2 fingers underneath the belt easily. Tape up the excess after you fold it up and then tuck it inside the belt. Next, you're going to place the battery on the suit donor's dominant side. Place the battery on the belt so that it locks into place. Plug in the powered air purifying respirator. Next, you're going to prepare your hood. You're going to snap the hose into the outside orifice on the hood. Reach over and turn on your powered air purifying respirator, and then place the suit over the head of the suit donor. Next, you're going to fold the outer shroud up and have the suit donor place their hand up there to hold it out of the way. Next, you will tuck the inner shroud into the inside of the suit. Once you've tucked the inner shroud, finish zipping up the front of the suit and taping the seam. Then pull down the outer shroud. After taking care of the patient, you will do a thorough hand washing on the outside of the gloves, making sure that you're getting rid of any debris that could be on them before taking off the suit. Once again, drying your hands thoroughly and using a hand sanitizer to remove any debris that could be left on the outside of the gloves. Standing in the tub with a biohazard bag, we begin the suit doffing process. Your suit support person will be in some type of PPE like this and will begin to wipe down with Clorox wipes from head to toe, making sure to get the whole surface of the donnor's suit. This should be a very thorough process, making sure that all creases, the hose, the papper, the face shield, all the way down to the boots gets wiped off. This process should be done very thoroughly and may take several minutes. Once you have wiped all the way down to the boots, the next process of doffing the suit would be to remove the tape and unzip the seam down to the belt. Next, you pull the inner shroud out all the way around. Then coming to the front, you will gather the hood and grab a hold underneath the face mask and lift it over top of the donnor's head. All of this will go inside of the tub except for the powered air purifying respirator that will lay just outside. Next, you will undo the strap on the belt, and your powered air purifying respirator will lay just outside the tub onto the floor. Be sure and go ahead and turn off your respirator to save the life of the battery. Next, you will go ahead and remove the rest of the tape on down the front of the zipper in the seam. Once you've done that, go ahead and finish unzipping your suit. Next, you will roll outwards and roll the suit off of the shoulder of the suit donner, rolling it right on down as to keep any debris that could be on the outside of the suit away from the exposed donner. You will unroll the suit and pull it right down off of the arms so that the suit donner can remove their hands from their gloves without having to remove the tape. Next, you will keep unrolling the suit all the way down, making sure that you keep it inside of the biohazard bag until you get to the top of the boots. Then you place your hand on the back of the boot and have your suit donner step out, one foot and then the other, outside of the container. Then you will grab the gloves off of the tips of the fingers and place them in the receptacle. Once the suit is off, a thorough hand washing and sanitizing is in order. After doffing the suit and washing the hands and sterilizing, the suit donner will then go and take a shower and put on clean scrubs and begin the rehab process. Making sure that we document all of our findings so that we can keep that record for future use if needed.